Hi, everyone. This is the video for 9-1 Human Growth and Development. Let me share my screen. And- Okay, so let's go through this. So this is late adulthood, physical development. Of course, a lot of people label people who are uh, old as more than just old. They believe that they're weak, that they don't have the same mental capacity as someone who's younger. They have no energy, etc. They don't even think they have sex. So late adulthood begins with 65 and continues till death. And we don't come up with these really fancy terms. It's just simple terms like young old, and oldest old. So you should know what each one of those mean. Young old is from 65 to 74. Old would be 75 to 84, and oldest old would be 85 and older. One in every eight people is 65 or older. By 2050, 25% of our population will be over 65. The fastest growing population is that over 85. We're living longer. You know, lives have doubled over the century. So this is a trend that we're seeing in every single developed country around the world. Again, you don't have to memorize the chart, just gives you a visual of what we're talking about. There are stereotypes to people who are old, or I should say, look old, according to society. There are a lot of negative attitudes about attractiveness or competence. There can actually be job discrimination based on age. There are definitely cultural differences in the United States. We're an individualistic society. Many people look on people who are elderly as fragile, weak, uninformed, not with it, etc. Other cultures, like Native Americans and the Asian culture, revere their elderly. They believe that they are wise. So there are two types of aging. We have primary aging and secondary aging. Primary aging is something that you can't change, like our bones become thinner when we get older, our enamel on our teeth, even with um, you know, brushing all the time and good dental hygiene tend to become thinner. Our taste buds change, our sense of smell changes. Outward signs would be like secondary aging. This is like physical things that we may have done. Maybe you were in the sun a little too long trying to get that tan, so now our skin is wrinkly or leathery looking. Okay, we actually can lose height up to 4 inches. You can lose off your height. That shrinking is because our bones become thinner. Osteoporosis, we see more in women. About 25% of women over 60 have that. And it's the primary cause of why older people, when they fall, break bones. Again, there's a double standard in our society and Western culture. Women are judged much more harshly on their signs of aging. And gray hair for women, the stereotype is that they look old, whereas men with gray hair look distinguished. So many women, to try to fight this stereotype, especially if they're in a job where they're very much on display. So, like a news anchor or a teacher or a nurse or a doctor or things like that, they may dye their hair or have cosmetic surgery, Botox, tucks, lifts, you name it. Um, there are people that have a surgery over surgery over surgery. or Botox over and over again to the point that you can't tell if they're smiling or not because their skin is so taut. There's also internal aging that goes on. The brain actually shrinks size and is much lighter. Vessels shrink. Our respiration becomes less efficient. Digestive system also more difficulties. Uh, we can work on these things, but you can't necessarily change everything. Uh, Physical fitness is always a good thing to do. Start small and build to your endurance. Don't start out running, a 25, 26 mile marathon. Okay. Our reaction time does slow a little bit, but that's a generalized hypothesis. That doesn't mean that everyone slows in speed. That will depend on your nervous system and how efficiently you are using your brain. But that reaction time can result in more accidents, whether they be accidents like in a car or accidents just in general in the home. Our vision changes, uh, pupils shrink, less light is getting in, your optic nerve isn't as efficient. Distance is bad, more light is needed, and especially at night, driving much harder at night with those high beams coming at you. Um, and if it's raining at night, so a lot of elderly people choose not to drive at night anymore, relying on Uber or Lyft or maybe even Access because at 65 or older they would qualify for Access. Cataracts is very common. Usually, if you get one in one eye, you're going to have it in the other eye also. It can involve surgery that is fairly routine now, but you can get implants, and who knows, now you might be able to get by without even having to wear glasses of any kind. If you haven't had glasses before, there's a good chance by this time you may need reading glasses and glaucoma, which is based on the pressure in your eye, is one of the important things to get checked for. Early detection can prevent blindness. Macular degeneration we see as we get older also. Uh, if you eat good foods rich in vitamins E and C and A, they may help you stem problems with your eye. Again, just getting a rough idea of what it would look like to visualize uh, the sight of someone who is slowly but going blind. You definitely wouldn't be able to drive like that, would you? Our hearing changes. 30% between 65 and 74 have hearing loss, more men than women. 50% over 75 have hearing loss, and it's typically the higher frequencies that are hard to hear. Hearing aids can help. Only about 20% have them. One, they're expensive. Medicare will pay for one set every 5 years, so heaven forbid if you lose one, and that does happen. Sometimes if you're in a nursing home, it will fall off into the sheets. They throw it into the wash. These elderly people can't afford to get new hearing aids all the time. Um, because of that, it's difficult for people who need these aids uh, in spaces that are very crowded. Because all a hearing aid does is amplify the sound. It doesn't only amplify speaking voice, but it amplifies all the sound in the room. So it's still hard to understand what someone's saying to you. So people can be embarrassed and they may actually withdraw and not want to go to any of these particular activities. Our sense of taste and smell changes. It discriminates, is discriminating with old age. We um, we use more salt. We don't have the same taste. Um, the additional salt that people put on food, many elderly people don't even taste the food, they just automatically salt it. Uh, Salt can raise your blood pressure. Blood pressure can cause heart problems. Getting elderly people maybe to use other types of seasonings that can help, but it's very normal uh, the older we get for our taste buds and our sense of smell. So, uh, you know, gustatory and olfactory are connected. And it's why a lot of older people say their food tastes like cardboard, so why eat it? To getting people to eat. The review, a couple questions, as samples, and less common disorders we see uh, among people, just general illness. They tend to get colds, flu, etc. More often. Uh, their immune system is weaker. Common things that we see, though, are heart disease, cancer, chronic respiratory problems. If they smoked, COPD is very common. Arthritis and hypertension, we see that even in middle adulthood, let alone late adulthood. And that arthritis can start with the hands, and it can start very simple. I always use myself as I have trigger finger. I can't pull up this finger on my own. I'm really trying. Sometimes people have arthritis so bad in their hands that all of their hands are like that. So it makes it very difficult to them to open containers and even something as simple as their medicines, things that we take for granted. At this age, 15 to 25%, 65 and older have a mental disorder, and the typical one is depression. That's the major one that we see. Uh, they may go to multiple doctors. They don't necessarily share all their information between the doctors. So if there's a problem with the meds, it's usually the pharmacist that actually spots this. The doctor may not even realize another physician put them on a different drug that they shouldn't be taking at the same time. And one of the things we always recommend for elderly is to get one of those pill boxes with the days and the dates. And when you get all your pills, get someone to help you do it. Put all of your pills labeled. This will also be helpful for children of that adult. Uh, if they're checking to see if they're taking their medicine, they can check the dates, making sure they're not taking more than they should be taking also. And then there's Alzheimer's disease. And so we're talking about 100,000 deaths per year here in the United States. 19% of the people between 75 and 84 have Alzheimer's, and about 50% of the people over 85 are affected. Some of the symptoms, unusual forgetfulness. Come on, even at our age, sometimes you get forgetful. You go into a room like, why did I come in? That's something simple. Forgetting that you left the stove on and then go to bed. Or people who were smoking a cigarette and put it in an ashtray and completely forget may possibly burn down their house. Okay? So other things that can pop up, problems remembering words during a conversation, uh, memory can go, and it's typically the most recent memory. We can hang on to that long-term memory a lot longer. Uh, Unable to recognize friends or family, total confusion, and even anger and uh, yelling and screaming and stress can happen for your loved one. So towards the end, loss of muscle control and may actually be confined to their bed. Uh, Victims of these early stages tend to be very anxious or fearful and depressed. And think about it, wouldn't you be if all of a sudden things that you could do before you can't do now? In the brain does change uh, during Alzheimer's. We're not quite sure what triggers, nothing's confirmed, but there's a correlation between genetics, there's a correlation between diet and high blood pressure, saying that it may increase your risk, viruses, hormone imbalances, low cognitive ability to begin with on IQ, and just an image. This is pretty straightforward. You can see the size of the brain and how it's changed and how the activity in the brain has changed in patients who have Alzheimer's. So there are no known cures. Uh, Acetylcholine can help a little so you can take medications that can increase that neurotransmitter, some anti-inflammatory drugs like Celebrex, chemicals high in C and E, so multivitamins or specific vitamins. Many people with Alzheimer's eventually are going to end up in a nursing home. It becomes very hard for family to care for them. And there comes a point that they can't be home alone. So if they are going to stay in the home setting, somebody would have to move in with them, caregiver around the clock. So what can you do? Um, Help them feel secure, help them be comfortable wherever they're at. Label objects, like I said, get the medicine little containers for the daily amounts of medicine. Keep clothing simple, like sweatsuits, shirts, t-shirts, not things that they need to tie or button, etc. Don't let them drive. They might fight you on that one, but don't let them drive. Uh, Watch their telephone use because they can just randomly start calling people. Provide some sort of exercise. There are great videos like chair exercises that are very easy for elderly people to do, and help them do self-care. That means bathe, get up in the morning, even if they have nowhere to go, just to wash their face and their hands, their private areas. Okay. And there is a relationship between aging and illness. Again, there might be a genetic predisposition. Uh, well off people of economic well-being tend to do better than people who are struggling. Any type of environmental conditions or psychological factors. Are they eating well, exercising, and avoiding unhealthy behaviors? Using drugs, smoking, alcohol, etc. Sex, yeah, use it or lose it. Yeah, old people still have sex. Yeah, I know for the young people seeing this, you may find that, amazing, but yes, they can. It's whatever they're comfortable with. Regular sex is associated with an increase in lifespan. Masturbation is very common, 50% for men and 33% for women over 70 do masturbate. Two-thirds of men and women over 70 have sex with a spouse at least one time per week. Men take longer to get an erection, of course. The refractory period is also longer. Women will definitely need lubrication. Vaginal skin is much thinner and can cause painful intercourse. So therefore, talking to their gynecologist can help knowing which to use and what would be most beneficial for them. And certain sex positions would be easier also for the elderly. 10% are diagnosed with AIDS over 50. They do have the opportunity of getting STIs. Age doesn't stop that. When we talk about genetic programming and how that works, we're going to continue that on the next topic, uh, but not on this video. Thanks and have a good day.